Hello everyone, can you hear me?
Yeah, we
Hello
can.
everyone, I'm Sanchika. Very welcome to all the participants and our respected subject matter experts and guests and speakers. Very warm welcome to you on this virtual consultation on concretizing the idea of endgame tobacco in India, which is organized in collaboration with SIPHER, RCTC and ECHO India. So this is the 19th session in the same webinar series. Today is the 5th anniversary of SIPHER organization. So congratulations to them as well. Now I would request Arun sir, who's the Director of Finance and Operations in SIPHER, for the welcome address.
Thank you, Dr. Sanchika. Ladies and gentlemen, distinguished guests and valued team members of the SIPHER. I am Arun Verma from Team SIPHER. Good morning, good afternoon, and welcome to this virtual consultation on concretizing the idea of the endgame tobacco in India, and also to the momentous occasion as we celebrate the completion of 5 years of SIPHER. It is an honor to be with all of you today and reflect on the incredible journey we have taken during these last 5 years. I want to express my heartfelt gratitude to each one of you. Our success story wouldn't have been completed without the commitment, passion, and the contribution that you all have poured into this organization. Thank you so much for that. As we celebrate the milestone, let us take a moment to revisit our roots. SIPHER was born out of a vision, a dream that took shape 5 years ago. Our founder, Dr. Rakesh Gupta and Dr. Sonu Goyal, had the courage to embark on this journey, and their determination laid the foundation for what we are today. I'll be failing in my duty if I don't mention the name of Dr. Rana Jay Singh, Deputy Regional Director, Southeast Asia, the Union, without whose valuable advice, guidance, and support, we would not have reached towards our aims and goals. As you know, no journey is without its challenges. We too had faced obstacles, weather storms, and navigated uncertain territories, especially during COVID period. Our collective availability to overcome hurdles, whether big or small, has defined us, and it is a testament to the spirit of this SIPHER. As we celebrate our path through this virtual consultation, let us cast our eyes toward the future. The next 5 years hold an immense promise. Our vision remains to contribute to the health and well-being of the people through strengthening public health education, supporting, developing, and implementing evidence-based public health programs, and scaling up locally relevant research in India and beyond. Our overall achievement of health-related goals and the targets as we defined under the Sustainable Development of Goals to 2030. Together, we contribute to innovate, collaborate, and create an impact on our journey has just begun. Thank you for being part of this incredible voice. Let us raise our toast to the past and present and the exciting future that awaits us. I wish to mention that during the journey of 5 years, SIPHER has organized 147 activities and events on tobacco control and related issues in collaboration or association with the RCTC, Resource Center for Tobacco Control, and Department of Culinary Medicine, School of Public Health, PJMR, Chandigarh, the Union, Healthy India Alliance, ICANN Care Chief Foundation, ECHO India, WHO, GSA, and few others. SIPHER is also running an induction program with tobacco control with the ECHO India, in which more than 80 medical doctors have registered, and it is a 4-month program. I also wish to share that SIPHER is now registered under the FCRA 2010, that is Foreign Contribution Regulation Act, and the Corporate Social Responsibility, apart from its registration under 12A of the Income Tax Act 1966 and approval for ATG of the IT Act. With this, let me convey our gratitude and extend a very welcome to our most respected guest of honor, Dr. PC Gupta, Director Healis, Mumbai, and Dr. Monika Arora, Vice President Research and Health Promotion at PHFI. I also extend a very warm welcome to our esteemed speakers of the day, Dr. Rakesh Gupta, President, Strategic Institute for Public Health Education and Research, SIPHER, Dr. Sonu Goyal, Professor, Department of Community Medicine, School of Public Health, PJMR, Chandigarh, Dr. Rana Jay Singh, Deputy Regional Director, Southeast Asia, the Union, Dr. Rakesh Gupta, President, Rajasthan Cancer Foundation, Jaipur, Mr. Binoy Matthew, Program Manager, Communication, VHAI, and Ms. Upinder Preet Gill, Director Program, Generation Savior Association. I also extend a very warm welcome to Dr. Sanchika, Manager, Project ECHO India, and Mr. Rajiv Chaudhary, Program Coordinator for the RCTC and Department of Community Medicine, School of Public Health. I also extend a very warm welcome to all our participants. Once again, thank you very much, and a warm welcome to all of you. Over to Dr. Sanchika.
Thank you, sir. Now I would request Dr. Rakesh Gupta, President, SIPHER Institute, for the opening remarks.
Yeah, thank you, Dr. Sanchika. Can you move the slide, please? Next, please. Next. Yeah. So we have received a message from Dr. Mira Aghi. She says that young people and future generations have the right to grow up in a tobacco-free world, a concept that has been formalized by documents such as Cape Town Declaration on Human Rights and a tobacco-free world. With this goal in mind, numerous jurisdictions have adopted tobacco-free future generation targets. If this has to turn into reality, we should not take any more time to decide. Tobacco-free generation is a strategy beyond reproach as it works towards a world free of tobacco. Tobacco-free people, tobacco-free communities, tobacco-free homes and environments. This makes it a winnable situation. And I may tell you that Dr. Mira Aghi, she's a behavioral scientist of international repute, and Society for Research on Nicotine and Tobacco honored Dr. Aghi's esteemed journey in tobacco control by initiating Mira Aghi LMC Research Award in Annam. She couldn't join in person because she's in California and the time doesn't suit. So thank you, Dr. Mira Aghi. So next, please. Next slide. So the best, I think, there is no one correct definition of endgame. Endgame that operationalizes our collective vision to end the death and disease caused by tobacco. As you know, that 13.5 lakh people in India alone, they get killed because of the tobacco-related disease each year. Endgame is not simply pressing harder on accepted demand-side interventions, although those policies are still vital. Endgame has a deadline due. This is very important. It will vary, but it is not someday. Endgame addresses tobacco as a systems value rather than as a behavioral issue. Endgame shifts the focus of policy from demand to supply and from the victim to perpetrator. So the best, I think, the definition is given by Truth Initiative. This is a set of policies and strategies to move towards the end of commercial tobacco and nicotine use, with the exception of Food and Drug Administration approved medications. So next, please. So I think I'll call Dr. Sonu Goyal. So Dr. Sanchika, you may please introduce Dr. Sonu Goyal.
Hello.
Yes, Sanchita ji. Yes.
Yes,
I think.
I think there was some confusion, Dr. Goyal. Let me, please. Thank you so much, Dr. Rakesh, for sharing with us the message from Dr. Mira, though she couldn't join us, and also giving us a brief of the various definitions of the tobacco endgame. Now, with this, I would invite Dr. Sonu Goyal, who is a professor in Department of Community Medicine, School of Public Health, Postgraduate Institute of Medical Education Research, PJMI, Chandigarh. He will be, discussing with us why we need to concretize the idea of end game in India, tobacco end game in India. I don't think Dr. Sonu Goyal requires any introduction. He is a well-known personality in the field of tobacco control and also in the other activities of the PGMR Chandigarh. So over
Yeah,
to
thank you,
Dr.
Verma ji, and
Sonu.
thank you, Sanchita ji. I think at the outset, I wish to congratulate SIPHER, especially Dr. Rakesh Gupta, and also all associated with him, including Arun ji and all other people who have been actually instrumental in bringing SIPHER to this stage in just 5 years. And I think on behalf of everyone here, I would like to congratulate you for successfully completing 147 events. I think that means a difference without, I think, much support, but you were able to galvanize people not only across country, but also you have done some international webinars as well. So heartiest congratulations, Dr. Rakesh, for this huge success. So now when I just remember those 5 years back when we were thinking about this organization, how it will be different and um, uh, how it can assemble all people in public health, in tobacco control. At that point of time, the prime focus was to what we thought about is to do advocacy for various public health issues. But as tobacco is close to Dr. Rakesh heart as well, and also mine, so we thought about having more events on tobacco control. But nonetheless, I think we had multiple variety of webinars and not only on tobacco, but also on hypertension, diabetes, and non-communicable diseases. And if I'm not wrong, Dr. Rakesh has also got some support from some organizations in between. I think 5 or 6 projects Dr. Rakesh could run along with his team. So congratulations, Dr. Rakesh, again. So now coming back to our, I think, end game, tobacco end game, and I think it is the very right time at 5 years of this ceremony of SIPHER, we are having a very apt webinar which we are conducting today, the idea of tobacco endgame. Because now people have started speaking in one tone on tobacco endgame. Although this is not a very new topic, I remember in 2013, when I was just a small entrant into tobacco control. I happened to attend a conference in which Dr. Prakash Gupta and Dr. Reddy. So they organized a conference in Mumbai, Delhi, I think in Delhi. So at that point of time, I still remember Dr. Prakash Gupta asked a question in the audience about tobacco and this tobacco endgame and when about the title about I think what should be the timeline for tobacco endgame, and do we have a specific definition which we need to define for India for tobacco endgame? Sir, I clearly remember that your dialogue, because I was just a very small entity at that point of time. I was not aware about much about tobacco control. So it was just a illuminary for me as well at that point of time, meeting you and great people in tobacco control. So and now after 10 years of that journey, I think it is the right time that we should strike now because of many facts. Number one is now the government of India is highly committed, not only in terms of the ministry, the ministry which is actively working for various initiative on tobacco, be it pack warning. India is highest among pack warning, be it tobacco, this banning of electronic cigarettes and like products, be it on largest quit line in the world, and lot of other successes. So, but also various stakeholders who are actually non-governmental organizations who are working passionately towards ending tobacco menace. So at previously when people used to ask in the webinars, or not webinars but physical meetings, that आप खत्म क्यों नहीं कर देते हो टबैको को? आप ये बोलते हैं कि टबैको कंट्रोल करना है, खत्म क्यों नहीं कर देते हैं? Then we had no answers actually. We used to say that tobacco is still, I think it's a truth that tobacco is governed by various ministries, and health ministry is a small one, and it's a behavioral problem, not a health problem. So a lot of answers are there, but now we are in that position to say, yes, there are some initiatives which have taken place in other countries, and India is in right position to initiate that tobacco endgame. And now I have seen, and I think Dr. Rakesh Gupta from Rajasthan Cancer Foundation, I think he is a testimony of the fact that over last 1.5 years, in the ministry's presentation, we are seeing that end game now. In three presentation at least, I have seen that they have put one of the objective or one of the things, one of the vision is tobacco end game. So now I think it's very right time to define that cutoff date when we should have, because tobacco-free generation is one of the integral component of tobacco endgame. So we should be able to define that date in consensus, and what are the various strategies among the things which have been used by various countries which are really applicable for India and achievable also. So we need to crystallize based upon the Indian scenario. So these are the two things which I think over a period of time, at least in next 1 year, we would like to see that the government of India should have some timeline, which the cutoff date, which should be decided. And secondly, what are the priority strategies for which India will be working, and a proper roadmap, like up to when it will be finished. So I think this is our overall aim. So I will not take you further to various strategies which are being used, but yes, I think in this webinar, in this consortium, so we will be discussing on them, and we will be crystallizing, I think, those strategies which will work for India, which has a potential to work in the Indian settings. So again, I congratulate Dr. Rakesh and the team, Arunji and all, for I think taking this initiative. Although I know that this initiative have been there before as well. We have Upenderji here, so I think she was also instrumental in talking about tobacco endgame. Dr. Monika, I can see she's also here. At that point of time in 2013, she was the lead actually in Delhi, who has galvanized people across country and globe to discuss on tobacco endgame. So thank you, Dr. Rakesh, for giving me the opportunity to introduce this particular topic, and in this session in the 5th anniversary of SIPHER.
Thank you, Dr. I'll request all to please switch on their videos so that we can have a good snapshot. So Dr. Sanchika is waiting for you, please. Please switch on your videos. Thank you. Thank you. So Dr. Dilip Acharya is also with us. Dr. Ramprasad is with us, and many other people from public health. They are here. Avdesh is with us. Thank you, Avdesh.
Dr. Rana is also there. I have not seen.
Dr. Rana is part of our team, so I'm not named. So Dr. Rana, good morning.
Good morning, sir.
Dr. Sanchika, आप ले लो.
It's done, sir.
उपिंदर अपना वीडियो ऑन कर लो प्लीज. उपिंदर की वेट कर लेते हैं 1 सेकंड. हाँ चलो, let's have a picture, good snapshot.
Done, sir.
हाँ, बाकी सारे ले लो आप, जो बाकी भी ज्वाइन किए.
Okay, sir.
Yeah,
Let's
okay.
move
Thank you.
forward.
Thank you. Thank you.
Good morning, Dr. Rana.
Good morning, sir. Good morning. Please allow me to share my screen. It's
Yes, sir.
okay.
Yes, sir. Give me a minute, sir. I would like to introduce you and then I will hand over to
It's
you.
okay.
So now I would like to introduce our guest speaker for today, Dr. Rana Jaising, who is a Deputy Regional Director, NCD and Tobacco Control in Union and Southeast Asia. Sir will be talking, a very warm welcome to sir. Sir will be talking about an overview of endgame strategy. Thank you, sir, for joining us. Now back to you.
Please allow me to share screen.
Yes, sir. Please go ahead.
Can you see it?
Yeah, yeah.
No,
It's
sir,
clear.
it's in
Yeah.
the presenter mode.
Yes. Yes, it's in presentation mode and it is moving also.
हाँ, ठीक है.
सर
Okay,
ये
okay. Thank
सर सॉरी पर ये प्रेजेंटर मोड है आप आपने अपनी स्लाइड्स का स्क्रीन पे डिस्प्ले किया हुआ है
Yes.
सामने बड़े स्क्रीन पे
Yes.
Sir,
that's the
visible
reason
नहीं है.
that's the reason we are seeing it as in a presenter mode anyway sir if you want you can go ahead
हाँ, वैसे भी चल सकता है ना? It's okay. Yeah.
Okay, thank you very much. Anywho, let me see. Okay, well, no, it might not go away. So thank you very much. First of all, again, congratulations on completion of 5 years of SIPHER, and we all have seen the progress it has made. If in one word, in one sentence, I would say that despite COVID and many other challenges, SIPHER kept us together by way of all those activities. I was surprised 150 plus activities, regular webinars, regular consultations, discussions. So I think this is really a big achievement. Once again, good afternoon, all of you, respected Dr. P.C. Gupta ji and Dr. Monika Arora, the guest of honors of today's function. Speakers, Dr. Rakesh Gupta from SIPHER, Dr. Rakesh Gupta from Rajasthan Cancer Foundation, Professor Sonu Goyal, Mr. Benoit Matthew, Ms. Upinder Kaur, and all the delegates for this very important discussion, which I often encounter various, you can say, we have to respond to some few important questions from global community also about this thematic area of our work. All you know, the World Health Assembly has already given us a target of 30% relative reduction of tobacco use prevalence by 2025. Tobacco control is also becoming, as far as SDG is concerned, we know there is a goal 3, and effective implementation or comprehensive implementation of FCTC Article 5, FCTC. WHO FCTC is an integral component of SDGs. So this is I think already we are already aware of this part, and we discuss this very often. But before I really go to tobacco endgame, we need to understand basically what is driving this epidemic, why this epidemic is still running. What are the factors which is driving tobacco epidemic? And you will be surprised to see that something which we call as very early initiation of tobacco use, it is one very important factor, which is which continuously posing a major challenge and continuing this epidemic. If we see our country, just see GATS 2, less than 15 years, 13% they use tobacco. Between 15 to 17, 23.6%. Similarly, from 18 to 19. And what do we see? More than 55% of tobacco users have already initiated tobacco use before they are 20 years of age. So this is most important, I think, finding from GATS 2. And thereafter, between 20 to 34, almost 45%, they use tobacco. So very early age of initiation is an important factor which is driving this epidemic. In addition to that, in our country, we know tobacco use situation is very, very complex. We have large number of varieties of tobacco use. And every tobacco use product, every product that requires a different strategy. Now, in last so many years, in every state, there are definitely local varieties of tobacco. In Madhya Pradesh, we have Godaku. In Mizoram, we have Zozial and we have Taboo. So many states now have high prevalence of smokeless tobacco use. There are many states which has high prevalence of BD tobacco. And for every tobacco use, we need a separate strategy. Then low tobacco taxes, it is continuing to be there. That still we have not been able to achieve that World Bank recommendations of tobacco taxes, and especially BD, which still remains very low taxed, along with the smokeless tobacco products. Then poor enforcement of tobacco control laws, very, very important. We have policies. Now it's almost now 20 years to COTPA, but still their enforcement is very poor, you can say suboptimal. And then limited cessation outreach. Limited cessation outcome is very important, which is still, although now we have National Tobacco Quit Line, in between we also had cessation, we have tobacco cessation centers, we have brief advice by health worker, we have also integrated TB tobacco with other programs like TB tobacco, oral health, NCD control. But still, if you see, there is the cessation outcomes that is not which will really help reduction of tobacco use prevalence. And above all, very recently there was a presentation or by study findings by Dr. Upendra Bhojani that for reducing tobacco use prevalence, having negligible or no interference of tobacco industry is very, very crucial element. Everything, if it is there, but to reduce tobacco use prevalence, we have to see that there is no interference by tobacco industry in public health or in tobacco control. So these are a few factors, few things which is driving this epidemic. In India, already Professor Goyal has mentioned that we had, so India again, I think very early in this phase of tobacco control, we had this conference in Delhi from 10th to 12th of September, and the people who organized that and raised this voice globally. So that was in 2013. And idea was to identify strategies which are important for ending tobacco-related harm to health as well as to development. And whether we can really set some global and country-wise targets to protect the present and future generation from harms of tobacco use. Often a question is asked. You see, when we started discussing, although we have FCTC article, FCTC, WHO FCTC, we have shorter version of FCTC, which is called WHO Empower. Empower is a great package. If we really implement it, we can have a reasonably well tobacco control in countries wherever we effectively implement that. But often, sometimes a question is raised about India, whether the country is ready for endgame. Maybe we will have discussion on that. maybe by Professor Gupta, Dr. Monika, Arora, and all. We will hear them. So whether the country is ready for endgame approaches, and what is our understanding right now? Are we aware what should be criteria? What are the strategies which endgame should have? While Professor Goyal was mentioning about the work, so definitely we need a guiding document what we want to do in our country. So this is something which I think will be the crux of this today's webinar. Already they have defined that endgame is a composite of strategies to reduce or contain prevalence of tobacco use to less than 5%. So this is now widely accepted definition. And once we have achieved that target, it becomes really very important. Means denormalization of tobacco use has already happened when we have this kind of reduction to 5%. And then it's not difficult to completely eliminate all forms of tobacco consumption. So currently we have the situation of 29% of tobacco use, and when that situation will come. So what should we do? We need to have, I think, if we want to go for endgame, we need to have a plan. Whatever we may call it as national action plan, national strategic plan, whatever we will like to call it, where we have short-term, mid-term, long-term plans. We need to set a target. It can be zero or it is close to zero prevalence of tobacco use. We need to develop, implement, strengthen current and new policy approaches which are already there. We need to complete or close to ending of commercial sale of tobacco products. How that will happen? And tobacco use being fully denormalized in society with virtually no exposure to children and youth to tobacco products. That is why the policies like tobacco-free generation ultimately comes under the ambit of tobacco endgame. So now this is really something zero or close to zero prevalence of tobacco use. Currently, we have 29% tobacco use prevalence above 15 years of age, with the absolute number of 267 million, that is 27 crore tobacco users. What should be our target? Now you see our neighboring country, Bangladesh. The Prime Minister of Bangladesh, she has already announced almost it's now more than I think 7 or 8 years tobacco-free Bangladesh by 2040. So that is something which we need to decide, and that should be covered. That should be part of national action plan. Currently, we have very good tools. NTCP, which aims to increase awareness, implement COTPA, strengthen tobacco cessation services, reduce production and supply. You see, that is mandate of NTCP is very broad. So everything which is there in almost FCTC that is covered in NTCP also. We are running mass media campaigns under NTCP. So reduce production and supply and facilitate FCTC implementation. These are the aims of India's National Tobacco Control Program, which I feel are very comprehensive. Current trends, you already know that from 2019 to 2016, we have a relative reduction of 18%. And now GATS 3 is coming. All preparations have been made. We are hoping that we will soon have GATS 3 data collection started, and that will, I think, personally, what I feel with experience from other countries, that will really tell us whether we are on right track as far as tobacco control is concerned or not. In between, there was COVID, and perhaps there was some slowdown of few things, not everything. On one hand, we also achieved those bans during COVID times. 26 states, they banned tobacco sales and maybe one or other kinds of ban. So that was also some good things which happened during COVID also. But at the same time, there were a few things which we missed opportunities were there. So what do we need to do? We need to develop, implement, and strengthen current new policy approaches. When I say many other things which we need to do now, in addition to anti-CP and CORPA. Now, these can be product-related approaches, like we want to regulate nicotine content to make it non-addictive. For that, you are already aware that now we are going to have national tobacco testing labs. We need to raise pH of tobacco products above 8 to make them difficult to inhale. There should not be any availability of no availability of pens. So these are a few things for which already you see ban has already happened. We need to effectively enforce bans on ends products. There can be user related. So user license. Secondly, prescription to purchase. Then policy on tobacco-free generation. So these are a few other steps which we need to take. Plain packaging, for which I think this is not something which is new. Dr. Monika, Arora, and others, they initiated this discussion almost a decade back. Then raising tobacco taxes, that we all know that BD and smokeless tobacco remains a challenge still, including most widely used cigarette products also. Tobacco industry interference, for that we have no code of conduct applicable to Ministry of Health, but we need a comprehensive 5.3 policy and tobacco vendor licensing to reduce availability and accessibility of tobacco products. So we need to progressively reduce the land under tobacco cultivation through substitution of nutrient-rich crops, shifting tobacco farmers and workers to economically viable alternative occupations. Some states are doing. I think Karnataka is one state which I can really give example where they are reducing the tobacco crop hectarage in a stepwise manner. We are expecting some case study from them also. Trade and investment measures which we need to take. Then divestment out of tobacco. Sinking led approach, you all know how we can reduce the quota on tobacco manufacture and imports. That should be regularly should be done. Target is very important. So to see that tobacco use being fully denormalized in society with virtually no exposure to children and youth. So that is one area which is driving this epidemic, which I mentioned in the beginning. So exposure of tobacco to children and youth is one important factor which will driving this epidemic. So how we can reduce that? Upholding other things which are globally, which our colleagues are doing about child rights, to curb exposure to tobacco smoke at all places, including homes and private transport, public places, effective implementation of child and youth protection policies, including TOFI, we have in our country, effective IC and mass media campaigns. So to achieve above suggested strategies for tobacco endgame, so we need to understand the epidemic. So and explore association among socio-demographic factors and tobacco use in children and youth in the country. We need to advance research to support a stronger, innovative, and evidence-based tobacco control measures beyond FCTC and requirement of a dedicated agency and authority. So this is something which perhaps earlier there was that India will have a tobacco regulatory authority. I think maybe colleagues can also highlight the progress or the benefits of having such an agency. But I think we have all seen the success of NACO, National AIDS Control Organization, an independent agency, took its very strong decisions with good budgets, authority to decide. So I think maybe if is there any need for a dedicated agency and authority for multi-sectoral integration, interagency coordination, wide-ranging partnerships, which remain central to fighting tobacco epidemic and countering tobacco industry interference. So this is what I feel that first of all we need to see whether we are ready for tobacco endgame. What should be the criteria? What are the components? So for that we need, as I mentioned in the beginning, a guiding document if we want to achieve our targets, and above all, a set timeline and targets. So thank you very much. Over to Dr. Sanchika and Mr. Verma. Thank you very much.
Thank you, Dr. Rana, for a very nice presentation on the overview of the endgame strategy in India, and also mentioning that if we really want to hasten the process of endgame, we need to target that how we can save our children and youth from the tobacco use. Thank you so much. Now I would like to invite our next speaker, Dr. Rakesh Gupta, who is the president of Rajasthan Cancer Foundation, Jaipur, who will be speaking on the components of the endgame strategy and talking points in its advocacy. I don't think Dr. Rakesh Gupta requires an introduction, and moreover, in the interest of the saving time, because he has a long list of his immense contribution with visible impact in the field of tobacco control, tobacco cessation, and tobacco endgame. So over to Dr. Rakesh Gupta. You're welcome, sir.
Thank you, Arunji. At the outset, I would like to congratulate SIPHER for the remarkable achievements, which are exceptional. The way it has moved the tobacco control in the country in last 5 years. As Dr. Rana said, even during the COVID time, the remarkable activities it conducted has set the norm that our tobacco control, educational activities, interactions, these have become online. And that has been very useful because it saves on cost, it saves on the physical effort, and it helps to bring the people together for a shorter period of time with focused attitude to learn and to interact. So very grateful and hearty congratulations to Dr. Rakesh, Arunji, and the rest in the team. And to all of us, we have been part of SIPHER as well. We have never felt that we are out of it. May I share? I got the, okay, rights to share. So let me begin with the subject proper today. And yes, I have a presentation which might go a little longer because of my recent learning in the endgame from the masters who have been working for over 2 decades for endgame, and I have been talking about it for time and again for almost 15 years now. Way back in 2008, I remember that I have connected with all the leaderships in tobacco control to ask them whether they would not consider having a tobacco-free India. And everybody said yes, but we didn't know how to go about it. And then we had this conference in 2013, International Conference on Endgame. I was fortunate that Dr. Reddy had put me in the concluding section as the representative of participants, and I had talked about becoming tobacco-free in the workplaces and taking this as a lead for tobacco-free or the end game for tobacco. So what is the end game for tobacco? And I think Dr. Rana has given a definition which is a very appropriate definition, it appears to me, which is comprehensive as well in view of the technicality or the legality it provides, that it says to eliminate tobacco within a timeline, the structural, social, and political dynamics that sustain the tobacco epidemic. I think these words are very important in view of their comprehension and the way these have been phrased. I think that is what is most important for us. So throughout my presentation, I will try and emphasize on the phrasing which I have learned recently to the course that I have done of ASH USA on endgame. And for everybody of us, what we consider as the more usual kind of definition which every person can use, a lay person can also understand, Endgame means phasing out the sale of all commercial tobacco products, making the future free from the purchase of all tobacco products. The purchase is important and the sale, both the words are important here, that how do we phase out the sale of tobacco? But yes, if the people will not purchase, naturally they will be phasing out of the tobacco. These are the components of endgame as listed by ASH USA, that we need to have a definition of endgame that is acceptable to all, and we can work on it rather quickly. The potential endgame policies we have modeled from New Zealand, which has combined in endgame the smoke-free New Zealand tobacco vendor licensing reduction by 90% in next 2 years, and having the availability of very low nicotine cigarettes, to which I don't agree that it is the right way to go about. But yes, there are many people who would say that, yes, this makes the radicality little diluted for asking for the end game. The third point is breaking society's addiction to tobacco and deconstructing norms. The tobacco is deeply rooted within our societal norms. So constructing those norms which will deroot the society tobacco use is going to be very important, the addiction in particular. And one of the things I learned in reference to tobacco is don't talk about the habit of tobacco. It is the addiction to tobacco. Every time we should not be calling it habit, because the addiction comes in very quickly. The fourth point is legal consideration, including FCTC treaty and the trade agreements globally. And we need to go from global to local when we are thinking of endgame in India. Also, we need to think of the SDGs and non-communicable disease control. There is a global action plan already which recommends the reduction of tobacco use by 30% by 2025. We should be able to achieve that, as I suppose, but I consider going beyond it is very important for the high burden countries. And I remember asking one of our mentors as to why did we not decide on high burden countries a target of 50% instead of 30% in view of the deaths that we have. The sixth component is to correlate the end game to the environmental issues, the exposure to the carcinogens such as pesticides, tobacco-related pollutants, etc. That again is a very important issue which can get very popular soon and get a very wide societal support. So I think this is a very important component to the end game. Then multi-stakeholder engagement, as we have been vying for it for rather long now, is the time that this becomes visible. It's very important that we think about how to bring the stakeholders on the table, those who are decision makers in particular. I think that is the requirement we have. Then we need to have a strategic planning, harnessing local resources and appropriate messaging resources. I think the session on endgame by Laurent eBay was very useful. I consider we need to learn from that as to how we can have the resources readiness. And I think here the SWOT program for our own status in endgame will be very important. Working for media and building narrative, countering tobacco industry rhetorics, etc. are very important. I'm looking forward to what Binoy has to say about it. So endgame needs a paradigm shift. There is urgency to realize that tobacco epidemic is an industry-driven epidemic. The paradigm shift is necessary because we have been so far working on people-centric solutions, focusing on behavioral change, asking for tobacco cessation, asking for people to become tobacco-free. The need is the removal of the industry, making the world tobacco-free. I brought in here the picture of the movie Avengers as to this, I think, in a way, simulates what we require here, that we need to end the tobacco industry, and that is what is the fundamental principle behind the end game. So we need to move actually from failure to success. And this is because we have seen the inability to regulate tobacco optimally world over. And because our goals are diametrically opposite to the tobacco industry. So it's important now that we move from a failed method to what can succeed. There are two impactful points in advocacy for the end game, therefore. That it is unjust to addict people to a product that is likely to kill them. We have never said the word unjust. I think that is very important word that we need to speak every time in our communication, that it is unjust. And what is not just is generally judicially, something which is pushed on us unduly and in a way that can hurt us. So I think this is very important advocacy point that we need to remember, that it is unjust to addict people. Second is, it is unjust for the governments to allow it. That I think is very, very important issue. And if we look at the human rights from the human rights angle, endgame is a call for human rights as well, because tobacco is a barrier to this, be it women's right, be it children's right, be it the disparity, racial disparity, inequality. It is unjust absolutely for the governments to let co-industry continue. There is no reasoning behind it. I do not really believe that we should be really going for so many measures like tobacco vendor licensing, tobacco free generation. We will be wasting a lot of time instead of asking for one. This reminds me of the Mahabharata episode where Arjuna had to pierce the eye of the fish in Swayamvara. I think that is what we require to do here. We need to really focus on endgame, ask for it, and go for it with a timeline. So people working in tobacco control hope and wish to succeed someday. Now, this has been happening for over 2 decades as we are all engaged into it. But why not sooner than later? This is my question. And why not through a timeline? Dr. Rana has spoken about it. The timeline needs to be set in. That is very important. Every activity has to have a finish line. That is very important. We need to be realistic, move from some day to a specific day. Until we move to this specific day, we cannot really organize our activities. I have seen this particularly in my own individual behavior of everybody. We are all tuned to appear in exam and get through. That is very important. So I think moving to a specific day, deciding on it, we need to consider the lives of the adult Indians which are at stake. And we need to look at the loss that is there daily, which has moved. Actually 2018 data of history is almost 5 years old. Even if we consider it in a way to be have the impactful advocacy, the number of deaths must have increased. Saying it that these are 4,000 daily perhaps may be justified, comes to 1.5 million annually. So 15 lakh adult Indians are dying every day. And we are not talking about it. Our leadership is not talking about it. We have changed the rules, basic rules through constitutional amendment in the country. We have done the demonetization. We have gone so far. Why not do this as well? So I consider, and we have been accepting this, me, Dr. Rakesh, Dr. Sonu, that India should be tobacco free in 2030. Is it the right way to think? I think collectively we have to take a decision. Even then, we will be losing, meanwhile, 10.5 million adults. That will be over 1 crore adult lives that will be losing due to tobacco-related illnesses. We need to make a choice between business as usual and the end game. That is what we really need to consider. Whether the end game is compatible with FCTC, this is a question which will be asked several times. FCTC Article 2.1 refers to the provision to evolve further from the recommendations. It also observed by the masters in a way that FCTC is the floor and it's not the ceiling. So whatever we do as innovations have happened in the past also in the form of plain packaging, which was not there in original FCTC. So I think calling about the end game, all governments agree to it globally, is something which is required. End game is therefore fully supportive of and is supported by the FCTC. Now, this reminds me to also say that impossible is possible. And I have learned this lesson through Dr. Marita Heffler, the additional professor on tobacco end game and senior editor of the Tobacco Control Journal. And what she said is that we have seen in tobacco control itself that impossible have become possible. Who had thought of smoke-free initiatives? Who had thought of pictorial warnings? Who had thought of packaging, plain packaging, etc.? This has all happened. So if this has all happened and this has become a norm, why it should not be possible for us to go for the end game? And we are not alone in this. We all need to speak with one voice. That is what is required, not only in India itself, world over. This is what is required. We are losing over 8 million lives every year. I think endgame is the call for the day. The point for India to consider is, should it be a policy or an act? I don't know. I have asked the legal experts. I am yet still waiting for their response to it. But what is that we want to achieve? I think this has been summarized here, that we need to have a strategic planning, which will depend on the key elements that are permanent and within a specific timeline of context, jurisdiction, policy, attitude, politics, all this in the local context. This is very important. And we need much broader support, as many groups as possible. And let us not lose hope on that. We have really not worked with the several groups which are there existing in the society, because we always thought tobacco control as something which is specific in a way, working with the public health people, working with the government agencies. I think time it is now to move with several other groups like environment groups, the self-help groups, and several others. So I will end my presentation here with thanking you hugely for your kind attention and welcome any questions that you will have. Back to Dr. Sanchika and Arunji.
Thank you, sir, for excellent presentation.
Thank you.
Now I would like to call Dr. Upinder Kaur, as the Director of Programs in Generation Savior Association. And ma'am will be talking on the topic of the progress made so far in India on components of endgame strategy. Over to you, ma'am.
Thank you so much. I'll be sharing my screen. Is my PPT visible?
No.
Not yet.
Okay, I'm not able to share my screen for some reason. It's giving an error.
You can send it to me or Dr. Sanchika.
Okay, just give me a second. I've sent it to you, sir.
To me?
Yes.
Okay. Okay, then you can start talking.
Yeah.
In the meantime, I'll send it.
So I'll be talking pretty briefly on it, and so is my PPT, because a lot has been spoken about what exactly we mean by tobacco endgame and how tobacco-free generation is a component of the endgame, and a very important component too. I do somewhere agree and disagree both with what Dr. Rakesh Gupta just said, that yes, I understand that, it's been more than 2 decades now that we have been working in tobacco control, and we've been calling all our activities as control measures on tobacco. And it is high time that we should be, concretely and very strongly asking for endgame. And that's exactly what all of us are working for, that, we want to put a stop to this menace that is there, and which is killing millions of people in our country and around the globe. But to start with, it's always better when we want to create that community mobilization for such a big move, because we know that, how the tobacco industry is there. And also we have seen that, the first talk on tobacco free generation was initiated way back, if we talk just about our country, it was started in a conference that happened in New Delhi in 2013. So and we still don't have any policy document for that. So so I think we can move to the next slide. We all are very clear about the the definition that we have for tobacco-free generation, that we really need to end this cycle of experimentation, addiction, disease, and death by phasing out sales of tobacco products to youth born after a certain date. And I think the entire discussion today started when Dr. Sonu also said that, the one most important component today that we have to decide as a group and as representatives to tobacco control, that what is that cutoff date that we want to work on, what is that cutoff date for the next generation, for which we want to create an environment which is safe enough that they are not exposed to the tactics of the tobacco industry, they're not exposed to active smoking, they're not exposed to any kind of glamorization of tobacco use. So creating that safe environment for the generations to come requires a lot of steps, and those are the steps that somewhere all of us are working in one form of, or the other. And to me, if I want to define tobacco free generation in today's perspective, would be basically consolidating all that activities together and coming up strongly in front of the ministry that, fine, this is what we've been able to achieve in last 20 years. Very rightly said by Dr. Rakesh that, way back then, even smoke-free rules was something that we could not even think of, that, that they can come place. And people who've been working since that time, they know that how difficult it was to convince that, we want to put a restriction onto the smokers, that these are the places that they cannot smoke to, and they will be restricted to very few places where they can actually, smoke a cigarette or bidi or any form of smoking devices. So I think if we kind of map our activities and we kind of come up with a module in one state, or maybe in some region, if we talk about region, if few states can come together and we can come up with a regional module for TFG, and we can propose it even much stronger to the ministry that, this is what we have already achieved, and we are now in that mature stage of tobacco control wherein we can ask for an end game. Can we move to the next slide? So this slide, I think, is very popular with all of us tobacco control advocates, for all the kinds of advocacy that we do, that, there's a lot of work that is being done in different public health issues, but tobacco somehow still needs to come on the priority list of the government. And even when it is, the tobacco is the risk factor for the 8 leading causes of death, and we have separate programs for all these 8 diseases, and tobacco being a very important component of it. Next slide, please. So why we need to focus on tobacco-free generation is what I understand from this slide, which is basically an overview of the GYTS4 that happened in 2019. That, and that was among the students of the age group of 13 to 15 years, that in our country, 8.5% of this age group of students use tobacco in one form or the another. So we really need to retrospect in the activities that we all are doing, in the policies that we all are making. And I'm sure that Mira ma'am has been there throughout when this talk of this initiation, this talk of tobacco-free generation initiated. And she's always very strongly advocated on the fact that, we really need to get the youth perspective also into it when we are kind of, trying to formulate a policy, or trying to create one environment which we, as per our understanding, think is what is required. But we really need to also understand what the students of this age group, identify tobacco free generation as, or identify tobacco endgame as. And I'm very happy to say this thing, that under the leadership of the union month and Dr. Mira Aghi, we are in a way of conducting the study wherein we can get this this overview of the youth perspective towards TFG and towards tobacco endgame. Next slide. So I think we can move to the next slide. Next slide, please, because I mentioned about this that in 2013 the talk for tobacco-free generation initiated in our country, but we are here 10 years from now, from that day, that we still don't have any concrete policy even for TFG, rest aside, endgame. So components of TFG, which have, so these components have actually come out from various consultations that has happened under various leaderships and under different at different forums across the country. And the major components of TFG, and this was the topic that was given to me, that to kind of highlight where we as a country stand when we talk about TFG. So the first one, I think, the strict compliance of TAPS ban, including internet-based and online advertisement and promotion. Still, this being there in the law, so CORPA Section 5 kind of, regulates this, but still we see a lot of violations. And also we see that how tobacco industry is kind of, playing with this rule and targeting the youth specifically through the mediums that the youth are there on. And in one of the consultations that recently happened in Delhi by RCTC, so this was the point that came in, that when we as tobacco control advocates now need to address the youth in the same manner and at the same mediums where the tobacco industry is kind of catering them. So we really need to look back at our states and see that the compliance of the strict implementation of TAPS ban through all mediums is taken care of, and that is the base of creating that safe environment that we are talking about. Then when we come to about increasing the tobacco assessed age to 21 years or 25 years in some states that they're advocating to bring it at par with alcohol. So we still in our country doesn't have any state who has come up with this amendment, but yes, there are being efforts done at different states, and their files which have in some states which have gone through the state assemblies, and they're lying at the center. And to name a few, Karnataka, Rajasthan, Punjab, and I think even Bihar is one of them. So that is one, I think, breakthrough that we all are looking forward to, that which state comes up with this amendment first, and then that can be replicated in different states, as it has been done for the next component of TFG, which is a national policy for Article 5.3. As we all know that we still don't have any national policy for FCTC Article 5.3, but 22 states in some form have some policy or circular or a notice in that perspective. So we really need to now advocate collectively for the national level policy also to come up, especially when we're talking about an end game, because that is one place wherein we are going to see maximum tobacco industry interference and resistance to all our activities. So before we start asking for a complete end game policy adopted by the government at the center level, we really need to first push on the Article 5.3 policy. And I'm sure there'll be some in favor of what I'm saying, and there could be some questions and answers on that. And that is what the healthy way of discussion should be. Then comes on effective e-cigarette and hookah bar ban. We know that the e-cigarette ban was also a downward to upward approach, wherein we had different states with Punjab under Dr. Rakesh Gupta leading the scene of banning e-cigarettes, and then we have at the center level PEGA. But again, an effective enforcement of that ban becomes very important, because we are seeing this thing that e-cigarettes and all these vaping devices are actually coming up as the next big menace for our youth. And that is also something that we really need to retrospect and look into, that we do have that law in place, but what are the next steps for enforcement? That becomes very important. And when we talk about hookah ban, we do have some states like Gujarat, Punjab, Chandigarh, Haryana, Karnataka has already proposed an amendment. West Bengal, in West Bengal, we have the hookah bars banned in Kolkata through an order, and even Maharashtra, it is under process. So again, a blanket ban on hookahs and hookah bars, be it herbal, be it tobacco, everything should also now, it's high time that we do have a collective ask for it, that we don't have to go state-wise or city-wise to get those bans. Similarly, when we come to compulsory tobacco vendor licensing, still we don't have any state which has state level legislation. That is also one very important element, even when we talk about end game, because in those years wherein we are going to achieve that year, like 2030, I was seeing in the chat that we all are asking for that, we need to end tobacco menace by 2030. But before that, we really need to kind of also regularize this unorganized market that is out there and identify the logisticals and the retail chains of it. And I'm sure the next very important element is on strengthening tobacco cessation services. The country is very much committed to it, and this is the country's priority also. We have seen ministry talking about this at different levels. We see the states and the districts working on strengthening the tobacco cessation services. So this basically are the major components for tobacco-free generation, which is again a further component of the end game, the tobacco end game that we all are talking about and we all are seeking and working towards. So I guess many activities are happening in different states and different places in the country and also at the center level. So once if we can kind of consolidate all those activities and strongly, we will be able to strongly advocate that, okay, fine, we've taken the first step towards end game. Now we need a commitment from the government and other front groups to come up on that. So that's basically all from me on this topic, and I hand it over to the organizers. Thank you.
Thank you so much, Upinder ji. Very nice presentation, and thank you for linking the tobacco frustration with the tobacco end game. As you all know, GSA is in the field of this tobacco control for more than 25 years. When I say GSA, it means Upinder Gill's family. If I can say that tobacco control program of Upinder Gill ji have grown simultaneously, the last 20 years. So she's very well aware and familiar with each and every development in the field of tobacco control. That is why she's quite very well deep into this idea of tobacco control and all other activity joining this. Thank you so much, Upinder ji. Now I would like to invite our next speaker, Mr. Binoy Matthew, who is a program manager communications with the Voluntary Health Association of India. He'll be speaking about the importance of the earned medical in TC and the end game strategy. Over to Mr. Binoy Matthew.
Thank you, sir. A very good afternoon to all of you, and I'd like to thank Dr. Rakesh sir and the entire team of SIPHER on completing 5 years of good work in the area of public health. We have been associated with sir and the SIPHER team, and we have been seeing throughout these 5 years the good work that has been going on. And Dr. Rakesh sir is one person that who keep sending us, keep giving us updates, so active he is, I would say that. Very active. So good to be associated with him and to learn so much from him as well. So my topic is on the role of media, and as everyone has been talking about, and I'd like to thank my previous speakers, Dr. Rana sir, Dr. Rakesh sir, Dr. Sonu sir, and Upender, who has already set up the issue that we have to target for 2030. And as Dr. Rakesh sir has said, yes, while we are working on tobacco control, we are being using the voices of the civil societies or doctors or academics. So one more important component that we have to engage with, and we have been engaging with them, is media. Because media is we have seen over the years that they are the one who are taking the voice to the larger audience, as if we talk about in terms of the policymakers or in general public. So we need to use them in a very strategic way, and how to engage them, that's our key role. And since I've been working at the national media, and I've been supporting the state level media as well wherever it's required, so this is the learning that I have seen. And as as we have seen in the tobacco control, how this media advocacy has helped us in taking up the various issues to the targeted audience, whether policymakers or general public, we have seen, for achieving a desired output. So mainly the focus was to, to highlight the issues to the common people that we are been working, that we have been doing on tobacco control issues. So under this, very important element is that we need to assist the media people with the facts and evidence, and this have been we have seen, while reports or important studies or fact sheets, that has been helpful for them, has been writing up the stories as well. So this we already know that what are the Indian media, newspapers, TV channels have been very important, have played a very crucial role in keeping, shaping the tobacco related knowledge and behaviors among individuals and the public. So this has happened because as a regular sensitization and engagement of journalists to keep the issues in the, and while during last recent, like recently here, and while talking to Dr. Sonu sir and Dr. Rakesh sir also during this regional summit, we were discussing that how, we need to, work very closely, and it's the role, like, we all need to come collectively because in states what we are seeing, and many of them are quite active, they are doing work, but somehow it is not coming up in the news. Of course we have to be very we have to be very strategic also, and we have to be very alert also, that whatever the information that we are sharing with our media friends, it should not backfire, so that we have to very collectively. So, and that's what I, while we were discussing that, at national level, how the collectively the state level, a good work that is happening, we can compile that, and how we can together do a story type, so that systematic, how we can sustain them, that we were discussing. So this we can, in the while we are focusing on the 2030, so this is also one area that we can work together, how we can engage the media, both the national and the state level media. So this is some of the ways that how we can engage them, that we are doing already, and we are continuing with that through various process that we have been doing, and that's why the stories have been doing so many times. Like for example, if say for example, if if like the while talking to Dr. Sonu sir and Dr. Rakesh during the regional summit, so like at national level media, the journalist wants to do a story on a national thing, like if say about 5 northern states, they have done say about some chalan in on the Kotpa thing, so that makes a story. So similarly, if something is happening say about in the state of Karnataka, or like if we take south states, or then we take north states, and there if we can engage with the state, a state cell, and also the organization, the civil society who's are being collaboratively, we can collect the information, and that information can be utilized for the national media as well. And of course the partners who have been working in the respective states, they can share with the relevant state media as well. So through this process also we can address the issues. So these are some of the voices which I have actually tried to capture. And yes, of course, apart from these, there are many voices as well, because it's not always that the civil society should come at the forefront of the media. There may be another resource people that I have seen, because in fact the journalist also wants to take the quotes of other resource apart from your organization. So this we can, of course we should do that. And I'm ready to support for this, and ready to engage with this. So this whole thing, so that we have some together a network, I would say, that whenever there is some stories or something big thing is doing, we have like for example, sometimes I talk to Dr. Rakesh sir, or Sonu sir, or Prakash sir, Monika ma'am. Sometimes the journalist wants to take various this thing. So this we can collectively have a network of this thing, and then we can develop this. Of course, we should develop this also. More and more new voices should come, so that they that can go in the news as well. So these are some of the past thing, and we have seen media has been a game changer. And during these are some which you have must have all have seen during the pictorial health warnings, when the media when took up this issue, then it became a national, a pan India, debate, and this was, widely covered across all, all mainstream media. So this was because this was result of a regular sensitization, and there was a network of the journalists who were actually leading this, the issue. So it was like, a two-way process, that, you were engaging with them, you were providing the information, and then they were working, so that way we can actually, while we are going forward, I would say going forward, we need to engage with them, and then further we that they will also then, help us. So these are some of the, the stories that have been, the media people have been writing out, and it's a result of the information that has been provided to them. Some of the, stories that has actually make the headlines, you can see, and this is includes both the national and the state level media. And some of this again, so this is the recently you have seen then how journalists, how the media people have been actually been writing stories for, what pushing it, like, the OTT platforms needs to be regulated. So that this was like, again, providing the information to the media people again, because as media people don't have time, they have been so, they've been, they don't, and they are not like, they are not advocate, I would say that they are not advocate. We need to engage with them, and we need to continuously, provide information, and we need to create a network so that that becomes an interest. And of course, I have seen in this last 15 years, it's tremendous, this the media has given the space to this tobacco control issue and binting. So these are some of the, news, you can see that. So this is some of the learnings, I would say, that we have seen. And of course, definitely we have to keep it as a sustainable, a process. It's not like, when I keep on saying this because, I have experienced this, because and many of, things happen, at the state level or anywhere. So we should not use, like, if any event is happening, then only you are calling them, or some reports or some studies, then you are sharing, then it lost the interest. So need to keep them, sharing with them. It's not necessary they will always publicize, but yes, of course, we should keep engaging them, like we are engaging with other stakeholders also. Like we, at the state level, we are engaging with the state, nodal officers or any other official. We are engaging with them. So similarly, we need to engage them. And in this process, I would say that, we should have a, not all media, like even if you have like 8 to 10, a good supportive journalists from the print, from the electronic, or the wire agency, we can have a good, a champion. We need to actually, I would say that while we are moving towards this 2030, end game, we need to build some champion journalists, those who are, going to support us in our campaign, those who are going to write us in, and maybe, they will help us to take our voice to the larger audience or to the policymakers. So maybe we can have we can strategize accordingly, who are the, supporting, who are very serious. We should not have anyone who are not serious. So we can have this thing, even if we take 4 to 5 people, like, Dr. I was sharing with Sonu sir, if somebody like 4 to 5 journalists we can have from Chandigarh or from Karnataka. So like we can have something like that, and then from national level we can collectively, we can have a group of, a supporting 15 to 20, who are being going to help us, support us in the near future. So once they are engaged, we can, sensitize, and then accordingly, we should, like we do, events and other consultation with them, with other stakeholders on tobacco control issues. Of course, we should also do it with the a journalist also, once in 3 months or 6 months we should have, so that what we want to share, that they can also share. So it's a learning process for each of one, what media's expectations is also, that one we can think of and we can strategize. And of course, we need to be very cautious, we have to be very careful, because the other side, the tobacco industry, is also using, and sometimes it can backfire. So whatever the information is going, we need to be very careful what we are sharing with the scene. And again, we need to have a group of a spokesperson, like, we need to have doctors, we need to have academic institutions, other stakeholders, many groups, youth groups we should have, where we immediately whenever there is something story is there or something, then we can use them, so that we can do that. And of course, best practice, I would say that, if one state, like in the state of Punjab, if something interesting is happening, well, we can use that for another state or maybe for the national. So sharing the experience from one state to other, we can do that. And of course, regularly there we need to do regular follow-ups. And one of the biggest challenge, I would say that, see, media houses runs due to the advertisements. So many of the, like ads are goes from the companies that you may have seen from the small plus tobacco. And sometimes, like for example, many times we give the information, but due to the space issue or due to the environment thing, so sometimes our stories are. But nevertheless, we have developed that relationship with those journalists which we have synthesized as, and they will help us this thing. So yeah, so this is my view, and I'm ready to help and support, wherever I can, to create a network of media representatives. Thank you. Over to you, sir.
Thank you, Binoy. Now I would like to introduce our guest of honor today, that Dr. Monika Arora is the Vice President Research and Health Promotion at PHFI, and also ma'am is heading Hriday. So over to you, ma'am.
Thank you so much, Sanchika. And at the outset, I would like to congratulate SIPHER and team led by Dr. Rakesh Kumar Gupta for completing 5 years, a very successful journey. And we all are well aware Dr. Gupta's dynamic, enthusiastic participation in tobacco control and how he has led the tobacco control campaigns as well as evidence generation and evidence communication in a very professional manner, I would say. And he has brought tobacco control on various forums where it was earlier not being discussed. So congratulations for having a very comprehensive approach. Also, I would like to thank all the presenters, Dr. Goyal, Dr. Rakesh Gupta, Binoy, Upinder, Dr. Rana Jaising for sharing up-to-date information on where tobacco control is in the country and their vision for tobacco endgame. As was mentioned, that this whole idea of tobacco endgame started in India with Ministry of Health and Family Welfare taking leadership on understanding whether India has the readiness for tobacco endgame, because India had at that time announced the prohibition on sale of gutka to be able to address smokeless tobacco, which was a step in that direction for tobacco endgame. Because a complete prohibition of tobacco products was not recommended in any best practice or FCTC guidelines. But with gutka ban, there was this discussion of tobacco endgame that started in 2013 and in the past 10 years has matured enough to be able to start thinking of having a vision for tobacco endgame, having a target, having timelines, and multi-sectoral action, which is required for not only concretizing the tobacco endgame, but being able to have an action pathway. Since two concepts have been discussed for tobacco endgame, reducing the prevalence of tobacco use to a level that it becomes a non-viable option for the industry to sell this product or manufacture this product, and tobacco-free future generation. So both these are important concepts which need to be developed with innovation. Community engagement is one component which I have felt in tobacco control has not been adequately addressed. We do awareness campaigns, we do involve village panchayat systems, stakeholders, but to get people's movement and people's support would be very important as we move towards endgame, because this whole campaign and this vision as well as target would be successful only when people embrace this concept and comply by it. So I think it is very important that we start thinking about meaningful engagement of community, meaningful engagement of youth, to have ownership for tobacco-free future generation, and also the fact that we have been in India successful in reducing the prevalence for tobacco control, but the new products entering the market, we need to expand the scope from tobacco control to nicotine use prevention, and for having the younger population understand the new products which are entering the market and how to be able to engage them in this tobacco-free endgame vision. On the media aspect, Binoy has very eloquently talked about the successes. We surely need to have social media campaigns and other media campaign be more sustainable, and not just have once a study is released, we talk about it and then there is no follow-up. But if we can have a sustained campaign, then that does highlight that the issue is important and needs to be prioritized by the decision makers and the policy makers. So just to congratulate everyone in tobacco control, we have made huge success in India, and India has been a global leader in tobacco control with the smokeless tobacco ban policies, tobacco-free film rules, expanding it to OTT, which other countries have not done. So we are a leader, but we should identify the gaps as we move in this direction of tobacco endgame. Smokeless tobacco, which is our principal form of tobacco use, we need to think about how to innovatively reduce the prevalence of smokeless tobacco as well, and how to accelerate the cessation for smokeless tobacco and for dual users. So that's a unique problem for our country and the region. So we need to think more innovatively and scientifically for solutions in that direction. The other gap we have identified from literature is the conflict of interest and tobacco industry interference, how we can, again, address it through multi-sectoral action. We have some success, but we have not been able to bring all the sectors on board, especially development sector, and tobacco is very much a development agenda. So we need to bring development agencies, ministries, as well as environment players on board. And last is we need to address and overcome the industry-led arguments on livelihood and other matters which remain loose ends, because as tobacco control community, we need to ensure that every time these arguments come up, we address them with scientific evidence. I would like to stop here and congratulate the organizers once again for an excellent webinar. Thank you.
Thank you so much, Dr. Monika, for a very nice, nice and brief address. And a very well said that a meaningful engagement of the youth and a community engagement is a key to the end game. Thank you so much for being with us. And once again, welcome to this event. Now I would like to invite our guest of honor, Dr. P.C. Gupta, who is a Director, Healis, Sekhsaria Institute of Public Health. Dr. P.C. Gupta is a well-known personality in this field for a couple of decades now. I don't think he requires any introduction. His contributions are immense and a long list of contributions. So in the interest of time, I would like to skip the introduction. Over to Dr. Prakash.
Thank you. Thank you very much, Arunji. And thank you for skipping the introduction. That was not required at all. Thank you very much. And first of all, like everybody else, I would like to congratulate SIPHER, the entire team of SIPHER and Rakesh. And I won't repeat anything, just saying that I fully agree with all the accolades that have been said about Rakesh and the SIPHER team. Fantastic, phenomenal work they have done. And they have made these online meetings a kind of norm in tobacco control, which everybody likes. everybody participates, and even in this meeting, I think there have been 60 or more participants at time. So that's wonderful. I would try to be very brief in my remarks. Just saying that the tobacco control is not something new. In 1960, it started in 64 with the first Surgeon General report, when everybody agreed there was a conclusive evidence that tobacco is causing lung cancer and other diseases. So what we are seeing now, where we are at now, is a result of 60 years, not just 5 or 10 or 20 or 30 years. But we see that tobacco control has been accelerating. But what we need now is further acceleration, not going in the same speed. And that requires keeping on working on the things and strategies that we have been working now until now and have been successful, and then working on new strategies also, like tobacco-free generations and all other strategies that we know. But we must remember that our final target for any strategy is not people. It is the tobacco industry. And tobacco industry now is an extremely rich, extremely powerful, extremely resourceful industry. So whatever we are saying, whatever we are doing, they have antidote to that. They already have their strategies. We are talking of tobacco endgame, and they already have their strategies to handle whatever we are saying. We already know, and fortunately our government has banned electronic cigarette because that was nicotine rather than tobacco. But that has happened, and the countries that have not followed that are suffering. They are having, they have succeeded to some extent in tobacco or cigarette control, but having epidemic of ends and in UK and USA, for example. But the industry is further ahead, we have to know. So they are going further on nicotine. And not only nicotine derived from tobacco, but they are also working and already experimenting and putting out synthetic nicotine. So even if we talk of nicotine products and tobacco products and try to regulate and ban them, they will come out, they are coming out, and soon they will come out with synthetic nicotine products. So they have always been ahead of us, and they are still very much ahead of us. So we also need to think ahead whenever we are thinking of tobacco endgame. It is not just tobacco endgame now, but it has to be nicotine endgame. Nicotine any form, not just from tobacco. So that is really my caution. And if you want to read about synthetic nicotine, I think the latest report of tobacco product regulation group is already out, or is getting out very soon. So there you can read about how industry is manipulating and using synthetic nicotine. So thank you all very much for your attention, and thank you to organizers once again. Thank you all very much.
Thank you, Dr. Gupta sir. So much, so nice for a very brief and a very, meaningful, the address. Thank you so much. You have been always a guiding factor to us. You have been always showing light to us. And all these 5 years, we had your blessings and your advice to us for continuing in this field. Thank you so much. Now we are quite behind the schedule, though we wanted to close this session by 1:30. So maybe I'm afraid that we may not be able to give time to the participants for the comments. But I would like to acknowledge the presence of Dr. Dalip, Dr. Ram Prasad, and Dr. Sahana in the seminar. So now over to Dr. Rakesh Gupta.
I think Rajiv will propose a vote of thanks on behalf of all of us. Thank you. Thank you, Rajiv.
Okay, thank you so much. Now, I request Mr. Rajiv Gupta to propose a vote of thanks. We all know that Mr. Rajiv Chaudhary, coordinator with the Department of Community Medicine and School of Public Health, as well as he is also with the Resource Center for Tobacco Control. Over to Rajiv Kumar.
Thank you, sir. Thank you for giving this opportunity to propose vote of thanks. First of all, and congratulations to SIPHER for successful completion of its 5-year professional journey. So we all get together and make this journey along. Thank you. And I, Rajiv Chaudhary, Project Coordinator at on behalf of Resource Center for Tobacco Control and SIPHER, I express my heartfelt vote of thanks to everyone gathered here today. A virtual consultation on idea of endgame tobacco in India has been an enriching and informative day. We are privileged to hear from the experts in the field and as well as the representative from various government and civil society organizations. Special thanks to our esteemed guest of honor, Dr. P.C. Gupta sir, Director Health, Sekhsaria Institute of Public Health, and Dr. Monika Arora ma'am, Vice President Research and Health PHFI, New Delhi, for providing insight on the topic. I also express my gratitude to all the speakers, starting from Dr. Rana J. Singh sir, Deputy Regional Director, the Union, Dr. Rakesh Gupta, President, Rajasthan Cancer Foundation, Rajasthan, and Manager, Communication, VHAI, New Delhi, and Madam Upinder Preet Kaur Gill, a Director Program, Generation Savior Association, Mohali. Their valuable contribution and insight on this critical issue has been truly commendable. Thank you, all the speakers. I believe we can all agree that it was a privilege to listen all these eminent speakers. So, dear friends and extreme professionals, an event like this is need a proper planning and attention to the details. So, I want to express my thanks to and congratulations to organizing team led by Dr. Rakesh Gupta sir and Verma sir, Arun Verma sir, for leaving no stone untouched and ensuring the success of this important consultation today. I congratulations and thank you. A special round of applause for all of us showing interest in this event. Without your participation, and none of us would have come this far. So thank you, everyone. Have a good day. Thank you, sir.
Okay, sir. Thank you so much, everyone. We are extremely grateful, sir. Thank you so much.
Thank you. Thank you all.
Thank you,
please.
sir.
Thank
Sir,
you.
Dr. Rakesh sir,
हाँ जी।
आपने मीटिंग स्टार्ट किया था, मीटिंग एंड आपने करना होगा, एंड
Okay.
मीटिंग फॉर ऑल.
Okay.